You know what? AI in healthcare is like the hot topic right now.
Yeah, it's everywhere you look.
Well, we're going to do a deep dive today
Oh, nice.
into this Congressional Research Service report.
Okay.
It's called AI Evolution in Healthcare. Have you seen this one?
I have, yeah. It's a bit of a dense read.
Yeah, it's pretty cack.
A lot in
So we're
there.
going to try to break it down,
Good.
pull out some of those, really interesting nuggets.
Yeah, make it digestible.
Exactly. So you can, impress your friends at your next dinner party.
That's right. Be the AI guru.
Exactly. Exactly.
Well, one of the things that struck me about this report is how it kind of reminds us that AI isn't this like brand new thing.
Right.
There's all this buzz about it now, but it's actually been around for decades.
Yeah, I was going to say, it's not like we just invented artificial intelligence.
No,
It's
no.
been in the works for a while.
We're just at this point now where it's become so much more sophisticated.
Okay, so what's changed? Like, why is it suddenly, front page news?
Well, a couple things. One is just the sheer amount of data that's available now.
Ah, right. Big data. Everyone's talking about that.
Exactly. And the other is the development of much more powerful algorithms, particularly in the field of machine learning.
Okay, so machine learning. Can you remind me, how is that different from like traditional programming?
Sure. So in traditional programming, you basically give the computer very specific instructions.
Right, like a recipe. Step 1, step 2, step 3.
Exactly. But with machine learning, you're not giving the computer explicit instructions. You're giving it a ton of data and letting it learn from that data.
So it's like instead of telling the computer how to make a cake, you're showing it 1,000 pictures of cakes.
Exactly. And the computer figures out the patterns and rules on its own.
So it's kind of like teaching a kid to ride a bike. You're not giving them a manual.
Right.
You're kind of just letting them figure it out through experience.
Precisely. And the more data the computer's exposed to, the better it gets at performing a specific task.
Okay, so that's machine learning. And the report kind of traces the history of AI, going all the way back to the 1950s.
It does, yeah. It's kind of fascinating to see how the concept of artificial intelligence has evolved over time.
What were those early days like? I mean, were they really building, like, thinking machines back then?
Well, not quite. Those early AI systems were mostly what we call rule-based systems.
Okay, so back to the recipe analogy.
Yeah, it's like, if this, then that.
So pretty basic.
Relatively speaking, yes. But even those early systems could do some pretty impressive things.
Like what?
Well, the report mentions Deep Blue. Remember that?
Oh, yeah, the chess-playing computer.
Right. It famously beat Garry Kasparov in the 90s.
That was a big deal. I remember that.
It was a huge milestone. But even Deep Blue, as impressive as it was still limited to a very specific task.
Okay, so not exactly the kind of AI we see in movies taking over the world.
No, not yet.
But it laid the groundwork for what we have today.
Definitely. And now, with machine learning, AI is becoming much more versatile and capable of handling much more complex tasks.
And the report breaks down how AI is actually transforming healthcare into 3 main areas.
It does. It's a really useful framework for understanding the different ways AI is being applied.
And the first one is diagnosis and treatment. So can you give us some specific examples of how AI is being used in that area?
Sure. One of the most promising areas is in medical imaging. We're already seeing AI systems that can analyze X-rays, CT scans, and MRIs to detect everything from fractures to tumors.
So the AI is like looking for patterns that maybe a human eye wouldn't catch.
Exactly. It's about augmenting human expertise.
Not replacing doctors,
Right. At least not yet.
but giving them this powerful new tool.
Yes, and the implications are huge. Imagine an AI that can analyze a skin lesion and instantly tell a dermatologist whether it's benign or malignant. Or an AI that can listen to a patient's heart sounds and detect subtle abnormalities that might indicate a heart condition. We're talking about potentially saving lives.
That's incredible. But is this actually happening, or is it still kind of in the future?
No, it's happening now. The report actually highlights a really interesting example.
Oh, tell me more.
So Google developed an AI system that can detect diabetic retinopathy from eye images.
Diabetic retinopathy, that's a leading cause of blindness, right?
It is, and early detection is key. This AI system was able to diagnose the condition with incredible accuracy.
So that's potentially helping millions of people avoid vision loss.
It is, and that's just one example. There are similar advancements happening in areas like cancer detection, cardiovascular disease, even mental health.
Okay, so AI is like revolutionizing how we diagnose and treat diseases.
It really is, but it's not just about diagnosis and treatment. The report also highlights how AI is being used to improve patient engagement and treatment adherence.
Okay, so how does that work?
Well, think about all the times you've forgotten to take your medication or skipped a doctor's appointment.
Oh, guilty as charged.
It happens to the best of us, but AI can help with that.
Really? How so?
Think personalized reminders, apps that track your progress, even virtual coaches that can provide support and motivation.
So it's like having a personal health assistant keeping you on track.
Exactly, and that can have a huge impact on patient outcomes.
Makes sense. It's one thing to get a prescription. It's another to actually follow through with the treatment plan.
Exactly. But there are also some potential downsides to this kind of constant monitoring.
Oh, right. I can see how that could feel a little intrusive. Like Big Brother is watching your every move.
Exactly. So it's about striking a balance between providing support and respecting individual choice.
Right. So transparency and clear communication with patients is going to be key.
Absolutely. And that's a theme that comes up again and again in this report.
Transparency? Okay, we'll definitely have to dig into that more. But you mentioned there was a third area where AI is making a difference.
Yeah, administrative efficiency.
Okay, that might not sound as exciting as, robot surgeons or personalized medicine,
It might not be as flashy.
but it has the potential to be huge.
It really
I mean,
does.
who hasn't spent hours on the phone with insurance companies?
Exactly. Or trying to decipher a medical bill, AI can help with that.
So what, like AI that negotiates with my insurance company for me?
Well, maybe not yet.
Okay.
But think about automating tasks like billing, claims processing, scheduling appointments.
Oh, right. Streamlining all that back-end stuff.
Exactly. And that frees up time and resources for doctors and nurses to actually focus on patient care.
Makes sense. So it's not just about making things easier for patients. It's also about making things more efficient for the entire healthcare system.
It is. The report actually suggests that AI could save hospitals billions of dollars annually by automating these tasks.
Wow, billions. That's significant.
It is, and that money could be redirected to other areas like improving patient care or investing in new technologies.
Okay, that's definitely something I'm going to have to remember for my next conversation about AI and healthcare.
It's a good one.
But I do have to wonder, what about the people whose jobs are currently doing those tasks?
Yeah, the potential for job displacement is a real concern.
It is, and it's something we need to be thinking about carefully. But the report also highlights that AI will create new jobs.
Right. It's not just about replacing humans, it's about shifting roles and creating new opportunities.
So like instead of data entry clerks, we'll need AI specialists.
Exactly. And we'll need people who can ensure these AI systems are used ethically and responsibly, which brings us to another really important point.
You're talking about trust, right? We touched on that earlier.
Yeah. We can have the most sophisticated AI in the world, but if patients and healthcare providers don't trust it, it's not going to be effective.
Okay, so how do we build that trust, especially when we're talking about something as important as healthcare?
Well, that's a big question.
It is, and it's something we're going to have to explore in more depth. So how do we build trust when it comes to AI in healthcare? I mean, it's one thing to trust AI to, like, recommend a movie,
Right, or play a song.
but to trust it with our health, that's a big leap.
It is a big leap, and it's not something that's going to happen overnight.
Where do we even start?
Well, I think transparency is key. We can't just treat these AI systems as black boxes.
Like, we need to know what's going on under the hood.
Exactly. Patients and providers need to understand how these systems are making decisions.
What data are they using? What are their limitations?
Right, and the report highlights some really interesting initiatives that are being developed to address this.
Oh, like what?
Well, there's this group called CHAI, the Coalition for Health AI.
CI, okay.
They're bringing together experts from all different sectors: academia, industry, government, patient advocacy groups.
So it's like a think tank for AI in healthcare.
Kind of, yeah. And one of their key initiatives is developing these things called model cards.
Model cards, what are those?
Basically, they're like detailed reports that provide information about how a specific AI model works.
So it's like a user manual for the AI.
Exactly. You can see what data it was trained on, how it makes decisions, what its limitations are, what steps have been taken to mitigate potential biases.
Okay, that makes sense. So it's about making the AI more transparent and understandable, not just for the experts, but for patients too.
Right. The more we understand how these systems work, the more comfortable we'll be trusting them.
Right, because right now it does feel a bit like magic, like the AI just spits out an answer and we're supposed to take its word for it.
Exactly. And that's not a sustainable model for building trust. We need to move beyond that.
So these model cards, that's a good step in the right direction.
It is. And CHAI is also working on developing standards and guidelines for the validation and monitoring of these AI systems.
So it's not just about like checking the box at the beginning and then assuming everything's fine.
No, it's about ongoing oversight and accountability, because these systems can evolve over time as they learn from new data.
So we need to make sure they're continually being evaluated for safety and effectiveness.
Precisely. And that's where the government also has a crucial role to play.
Right, the report mentions some specific actions that the government is taking to regulate AI in healthcare. What can you tell us about that?
Well, the FDA, for example, is already responsible for regulating medical devices.
Right, so like pacemakers and things like that.
Exactly. And they're increasingly focusing on AI-powered tools as well.
So if a company wants to market an AI system for, say, diagnosing cancer, they would have to go through a rigorous approval process with the FDA.
They would, just like they would for any other medical device.
And the FDA is also developing guidelines for how these systems should be designed and tested and monitored.
They are, and they're taking a very proactive approach, which is encouraging to see.
It's good to know that someone's looking out for patient safety. What about other government agencies?
The Office for Civil Rights is another one that's playing a key role.
Okay, what are they focusing on?
They're focused on ensuring that these AI systems aren't being used in a way that discriminates against certain groups of people.
Right, because we've talked about the potential for bias in these algorithms.
We have, and that's a huge concern. So the Office for Civil Rights is actually issuing regulations that specifically prohibit discriminations through the use of AI.
So it's not just like a suggestion or a recommendation.
No, it's the law.
Wow, okay, so they're taking this really seriously.
They are, and it's not just about enforcement either.
What else are they doing?
They're also working to educate healthcare providers about the risks of bias and the importance of using AI responsibly.
So it's like a two-pronged approach, regulation and education.
Exactly, and it's really encouraging to see this kind of proactive approach from both within the industry and from the government.
It does feel like there's a real push towards responsible AI development. But with so many different players involved, is there a risk that things could get, fragmented or confusing?
It's a valid concern, but the report also highlights efforts to create more harmonized standards for AI in healthcare.
So it's not just a patchwork of different regulations and guidelines.
No, there's a real push towards a more unified approach.
And that's happening both nationally and internationally.
It is, because AI technologies are often developed and used across borders.
Right, not like AI stops at the border.
Exactly. So we need to make sure that we're all on the same page when it comes to safety and ethics and accountability.
So it's a global effort. That's pretty amazing when you think about it.
It is, and it's still early days.
Right.
But the momentum is building. One of the most promising developments is the increasing involvement of international organizations like the World Health Organization.
The WHO, okay.
They've actually released a set of ethical principles for the development and use of AI in healthcare.
So it's not just about the technology itself, it's about how we use it.
Exactly. And they're also working to promote global dialogue and collaboration on these issues.
So it's like everyone's coming to the table to figure out how to do this right.
They are, and that's really encouraging to see.
It is, but even with all these efforts at the global level, what about the practical challenges of actually implementing AI in real-world healthcare settings? I mean, that's got to be a whole other layer of complexity.
Oh, absolutely. And that's something the report dives into as well.
It's amazing to think about all the work that's going on behind the scenes to make AI in healthcare a reality. But at the end of the day, it's all about the patient, right?
Absolutely. And I think we've barely scratched the surface of how AI will transform the patient experience.
So paint me a picture. What does the future of healthcare look like with AI?
Well, imagine a world where your doctor can use AI to analyze your genetic information,
Okay.
your lifestyle habits, your medical history to create a truly individualized treatment plan.
So like no more one-size-fits-all medicine.
Exactly. It's about tailoring treatment to your specific needs and risks.
That's incredible. Like personalized medicine taken to the next level.
It is, and AI can also play a huge role in preventive healthcare. Think wearable sensors that can detect early signs of disease.
Wait, so before you even have symptoms?
Exactly, so you can intervene early and potentially prevent serious health problems.
Wow, that's amazing. It's like instead of just treating diseases, we're preventing them altogether.
Precisely. And that could have a huge impact on both individual health outcomes and overall healthcare costs.
That's a win-win. But this all sounds very futuristic. I do wonder, will everyone have access to these amazing AI-powered tools and treatments?
That's a critical question. We have to be really mindful of not creating a healthcare system where only the wealthy can afford the best AI-driven care.
Right, like we don't want a two-tiered system.
Exactly. So we need to address things like affordability,
Of course.
data access, digital literacy.
Right, because if these systems are only trained on data from certain demographics, they might not be as effective for others.
That's a great point. We need diverse and representative data sets, and we need to make sure everyone has the skills to navigate these technologies.
So it's not just about the technology itself, it's about the infrastructure and support systems around it.
It is, and it's a big challenge, but I do believe we can create a future where AI benefits everyone.
I hope so. But it sounds like a lot of work, so where do we even begin?
Well, I think the first step is just staying informed.
Okay, so read articles, listen to podcasts like this one.
Exactly. The more we know about AI, the better equipped we'll be to make informed decisions about our own healthcare.
And to advocate for policies that protect our interests.
Absolutely. And don't be afraid to ask questions. If your doctor is using an AI-powered tool, ask them about it.
Like, how does it work? What are the risks?
Exactly. The more we ask these questions, the more transparency we demand from the healthcare system.
And we can also reach out to our elected officials, let them know that we care about the responsible use of AI in healthcare.
That's right. They need to hear from their constituents about these issues.
So it's about being an informed citizen and using our voice to shape the future of AI, not just in healthcare, but in all aspects of our lives.
Well said. It's an exciting time to be alive, but it's also a time for vigilance and thoughtful engagement.
That's a perfect note to end on. Thanks for joining us for this deep dive into AI in healthcare. We hope you learned something new and maybe even feel a little bit inspired to get involved in shaping this incredible field. Until next time.